Now we're looking at preliminary steps in radiography. So preliminary steps is more of like things that you do to ensure that the radiograph is actually what went on so nice and nothing was actually missing, no step was missing, you know. So for radiography, the steps you actually take for this include the following. It involves preparing the patients, make sure that all the equipment are intact, making sure that the environment is nice. You understand all those kind of things. So key preliminary steps in radiography is ethical and professional considerations. So you have to maintain professional conduct and patient confidentiality. You have to obtain permission for everything you are doing. You apply the principle of attire, that's as low as reasonable, achievable. You know, the patient preparation, you have to still ask them some 1 or 2 questions. You have to give them instructions, and you have to give them the right gown that they should wear for them to actually get the best imaging. So exam room readiness, you have to ensure that the radiographic room is clean and disinfected. You have to apply standard precautions. You have to prepare the necessary equipment and accessories on ground for the imaging. So patient positioning and handling is you use age specific competencies. You know, you provide comfort and safety measures. Then you control motion by instructing the patient to remain still and use immobilization aids. So technical setup is you have to make sure that the image receptor is actually nice, anatomic marker is nice, central ray direction is nice, source to image receptor distance is nice, and collimation, where you try to restrict the X-ray beam to an area that you just need to get the imaging, okay? And also the gonadal shielding. So exposure technique, you have to just ensure that the amount of radiation energy that the patient is being exposed to is just what is needed for, you know, the diagnosis. Then after the exposure, you have to evaluate and make sure that the image is very nice before the patient goes out of the place, you know. And you properly document so that you don't take the X-ray of or imaging of another patient and give it to another patient.